My name is Dr. Andre Van Mol. I'm a California family physician. My wife and I are 9-time foster parents, and I also represent the American College of Pediatricians. I'm asking you to oppose AB 2119. The state is mandating that foster children with gender dysphoria be exclusively what they call affirmed into treatment protocols that actually lack proven records of benefit or safety because of a condition that usually goes away on its own. Gender dysphoria, transgenderism, has an overwhelming probability of resolving on its own. The medical literature says it does so 80 to 95% of the time by adulthood. Underlying issues are what need addressing first. They can be many, and foster children are far more likely to have them. It's so simply because they're foster children and what put them into the system in the first place. The American Psychological Association's Handbook on Sexuality and Psychology specifically warns against a rush to affirm or transition because it risks neglecting these underlying psychological issues, and yet this bill says rush. The Endocrine Society guidelines state psychological intervention is all that is needed in some forms of gender dysphoria. This bill says no, not enough. The risks and permanent consequences of a minor undergoing transitioning are sober. It makes someone a patient for the rest of their life, and kids cannot grasp that. There is no medical proof of the long-term benefits or safety of a child undergoing hormone therapy and surgical transitioning, so it's impossible to scientifically recommend this pathway to minors. Hormones are actually not FDA approved for this use. I would submit that the bill's not pro-science, it's actually no science. Regret is not rare, but what's gone is gone. A 2011 Swedish study looking at post-gender reassignment adults showed a completed suicide rate 19 times that of the general population. I submit to you what's being proposed makes things far worse, not better. Last 2 points, if I may. Children have developing brains. I know this as a physician, I know this as a foster parent. Their minds change often. They don't grasp long-term consequences. Children should not be pressured into making permanent decisions that alter their bodies. And finally, people of faith help keep our troubled foster system afloat. Passing another bit of legislation telling them they're really not welcome is not going to be a help to the system. I thank you very much for your kind attention.